And thank you, DocTube, as well as ClearNet, for providing me this excellent opportunity to interact with the public to initiate our awareness program under the aegis of Diabetes India and RSSDI Punjab chapter. So I must thank our senior doctors who have motivated us to carry out this awareness program. So those doctors are Dr. Shashank Joshi, Dr. Bansi Sabu, Dr. B.M. Makkad, Dr. Amit Gupta, and many more. So we are initiating this awareness program under the aegis of RSSDI as well as Diabetes India. Status of diabetes capital of the world. So basically what is happening, we need to prevent diabetes in India. If we are going to treat the diabetes population and do nothing in prevention, then we will not be able to decrease the incidence of diabetes. So most important part of prevention is awareness. So if people are aware about the risk of diabetes and methods or lifestyle modifications, how we can modify our life so that we can prevent diabetes, is a great effort which has been initiated by RSSDI and Diabetes India program in interest groups with the endeavor that we should create awareness among public about lifestyle diseases. So what are the lifestyle diseases? Lifestyle diseases are the diseases which are due to the change in the lifestyle. If we have adverse lifestyle, those diseases are going to be present. So most importantly, those diseases are obesity. Previously, obesity was not considered as a disease, but increasingly now the the obesity is also being considered as a disease. So we must not take it as a sign of health, but if somebody is obese, so he should consider it as a disease. Important diseases, lifestyle diseases are obesity, diabetes, hypertension, respiratory diseases, cancer, cardiovascular diseases. So these are the important diseases which we consider as lifestyle diseases. And we can prevent these diseases if we change our lifestyle. And among the lifestyle components, diet is the most important component for prevention of all non-communicable or lifestyle diseases. Along with it, exercise, control of risk factors like obesity, hypertension, sleep should be sufficient. So these are the factors which prevent the lifestyle diseases. And out of these, most important are control of diet as well as exercise. So cessation of tobacco use, alcohol use are next most important factors which prevent or which help us control the lifestyle diseases. So out of diet, diet is important and we must have a balanced diet, low calorie, balanced diet according to the status. So we will be taking questions about diet, exercise, moderate exercise, and in people who are above 45 years of age, they should take doctor's consultation about extent of exercise, how much they can exercise. Anybody can have mild to moderate exercise, that is 40 to 45 minutes daily walk or cycling, moderate speed, 6 to 7 days a week. So that is going to help control lifestyle diseases. Risk factors: control of hypertension, control of diabetes, control of obesity, cessation from tobacco, avoidance of alcohol, and stress will be helpful. So these are the few factors which should be considered as awareness program among general public, so that they are in the opinion or they can think that they can control all these factors, and if they are having the disease, it can be controlled. But if they are not having the disease, these all factors will prevent initiation or culmination of disease in that population. So it should be our program. And for diabetes, diet and exercise, control of obesity, and control of lipids, control of hypertension is going to decrease the complications of diabetes. So our aim is first to prevent diabetes, that people don't get diabetes. And if people are already having diabetes, then they control it to decrease the complication rate. So complications of diabetes are very, very important because they lead to increased mortality as well as morbidity. So our endeavor under the aegis of RSSDI and Diabetes India is to generate awareness among public so that we can prevent lifestyle diseases and we can prevent diabetes, so that India can be the diabetes care capital of the world rather than diabetic capital of the world. This is the introduction to diabetes and awareness about diabetes, how it is going to help. Then comes the diagnosis of diabetes. How do we diagnose diabetes? So there are four classes of diabetes: type 1 diabetes, type 2 diabetes, secondary diabetes due to other causes, and gestational diabetes. So generally, the concept of diagnosis of diabetes is most important for type 2 diabetes as well as type 1 diabetes. About 90 to 95% of the people are suffering from type 2 diabetes, and 5 to 10% people are suffering from type 1 diabetes, and lesser incidence is for secondary diabetes and gestational diabetes. So if we consider the diagnosis, there are four factors, that is fasting blood sugar. Fasting means there should be no calorie intake for at least 8 hours. So that we consider as fasting. And fasting blood sugar, HbA1c, generally it is 3-month sugar, which is commonly known as, and then it is random blood sugar, that is after 2 hours after meals, anytime, that is random blood sugar, and the glucose tolerance test. So in fasting diabetes, the level should be, to label the person as diabetes, the level should be more than or equal to 126 milligram percent. HbA1c should be more than or equal to 6.5%. Random blood sugar, if we consider the classical symptoms of diabetes, that is polyuria, polyphagia, and polydipsia, that is increased intake of water, increased intake of food, and increased passage of urine. These are the classical symptoms of diabetes. And if random blood sugar at 2 occasions is more than 200 milligram percent, we consider the patient as diabetes. And oral glucose tolerance test, that is intake of 75 milligram of anhydrous glucose is ingested, and after 2 hours we estimate the blood sugar, and if it is more than 200, we consider equal to or more than 200, we consider the person to be having diabetes. So these are the diagnostic criteria of diabetes. And the normal blood sugar should be less than 100 milligram percent, and random blood sugar should be less than 140 milligram percent, and OGTT also should less than 140 milligram percent. And if person is having the sugar between 100 to 126 milligram percent, we call it as impaired fasting glucose. That is, the defect is there in the fasting glucose. And if the person is having random blood sugar or blood sugar after OGTT, that is oral glucose tolerance test, between 140 to 200, we call it as impaired glucose tolerance test or impaired glucose levels. So these are the conditions in this level which can be labeled as pre-diabetics. And HbA1c, it should be between, if for impaired, it should be between 5.7 to 6.4. So if we are having these parameters, we call it the person as having pre-diabetes. And pre-diabetes, if they go in for lifestyle modifications, sometimes they will not need any medicine or any pharmacological treatment in future, and they can prevent diabetes. So these are the things which are important for diagnosis of diabetes. So everybody should know the levels above which the patient or the person is labeled as diabetic, and the person is labeled as pre-diabetic. So once diabetes is diagnosed, our aim is to treat that diabetes. For treatment, we need to have the control of diabetes. For controlling levels, the fasting blood sugar should be less than 120. We call it as good control diabetes. And random blood sugar should be between 140 to 170 or 180. We call it as good control of diabetes. And HbA1c, the control should be less than 7%. We call it as good control of diabetes. So these are the parameters which we want to achieve with treatment of diabetes. So if we are talking about complications, if we don't treat diabetes, or even if there is good control of diabetes, still in long run, patients might have complications of diabetes, and those complications are divided into macrovascular complications and microvascular complications. Macrovascular complications means if the larger arteries are involved, we call it as macrovascular. So they are cardiovascular, peripheral vascular, as well as cerebrovascular complications. In cardiovascular, coronary artery disease is very important. Peripheral vascular, the peripheral arteries are getting blocked and causing the disease. Cerebrovascular is the brain which is involved. And microvascular complications involve neuropathy, nephropathy, and retinopathy. So diabetes is affecting the heart, diabetes is affecting the arteries, diabetes is affecting the brain, diabetes is affecting eyes, the peripheral vascular system, the kidneys. So these are being affected by diabetes, and with good control of diabetes, with non-pharmacological or lifestyle modifications or with medicines, we can control these complications. And by controlling these complications, we can save the patient from increasing mortality as well as morbidity. So this is the brief about diabetes, and how do we proceed with diabetes depends upon patient to patient. So my advice is, if you are not diabetic, but you have risk for diabetes, that is obese, family history of diabetes, above 40 years of age, there is pre-diabetes, the increasing blood sugar level is there, not to the extent of having diabetes, but less than that, we must go for lifestyle modifications, what we have discussed, that is exercise, diet, control of obesity, control of other risk factors, and we should get the baseline investigations done to know whether our organs are affected or not. If they are affected, we must get expert advice. But lifestyle modifications should be important for all the population who are at risk. So that is how we can prevent diabetes and decrease the incidence of diabetes. But once person is diabetic, I have already discussed the parameters of pre-diabetes as well as diabetes. Then we must take expert advice without fear and follow that advice accordingly, because the consultant or the doctor or diabetologist is going to give you treatment after examining the investigations, after examining you, what drugs are important or what drugs are appropriate for you, whether first going in for lifestyle modifications, and if it is not controlled, you need pharmacological treatment. And in severe cases where the blood sugar level is very high, people fear taking insulin. So insulin is the ultimate drug which is going to be there for control of diabetes. So these are the important basic factors which should be known to the common public. So other factors, some myths are there that the diabetes can be contagious. It can go from one person to other person. So it is not like that. Diabetes is a lifestyle disease. It is not a contagious disease. So it cannot spread from one person to other person. And some people have notions about the home remedies, or you can say the herbal medicines. So sometimes they may be helpful, but once you take any herbal medicine, it should not be from the from the quacks who prepare medicine by themselves. But if you want to take, some people are taking the other home remedies. So you can take, but you must check your blood sugar levels regularly. You must not stop your medicine. You can add dietary advice to that. And if it is controlled, it is very good. If it is not, because sometimes the other people of alternative medicine say that you must stop this medicine and take this medicine is going to work wonders. It will not. So still, if you want to try, you continue your pharmacological treatment under the doctor's guidance and check your blood pressure regularly. If you find the the other herbal medicine is effective, you can reduce your other medicine, but you must not stop the medicine. So ultimately, it is because of the insulin. So I must make you aware that why diabetes is occurring in type 2 diabetes, which is most common form of diabetes. The insulin effect is less. So, so the body needs more insulin to digest the calories or digest the glucose. So if it is less, the blood glucose increases. So we can increase the sensitivity of insulin by insulin sensitizers, or we can increase the level of insulin by other drugs which are insulin secretors. And now important drugs have come up like SGLT2 inhibitors, GLP-1 inhibitors, who are acting on other parts of the body to control blood sugar levels. So these are very good drugs which will be given under the advice of a specific consultant. So don't take otherwise medicine. If you are diabetic, you must consult the doctor and follow the advice to control diabetes. So that is what is we are initiating the awareness program, so that people must not have wrong notions about diabetes, and they work together with their consultant, the doctors community, to control diabetes, so that we can decrease mortality and morbidity related to diabetes.
Thank you so much, sir. Thank you. Thank you so much, sir, for this comprehensive talk. The session was really informative. And yes, we have received some queries from our viewers. So with all your permission, can I just put them across?
Yes, definitely.
Sir, the first question which we received, the question is, how long should I walk daily to combat diabetes? And the question is from Pramod Setia from Jodhpur.
So the minimum walk should be between 30 to 45 minutes, brisk walk, so that your pulse rate increases by 10%. If you are obese, you must take the consultation of orthopedicians also, that you must not have osteoarthritis, because if you have osteoarthritis of knee, that will be aggravated by walk. Then you can cycle, you can use the moving cycle or stationary cycle. So but minimum walk should be at least 45 minutes, about 5 to 6 days a week.
Thank you, sir. We are moving to the next question. The next question is, I have been diagnosed with borderline diabetes. How can I reverse it? Is it serious? And the question is from Ritika Rajpurohit from Jamshedpur.
Yes, definitely. That is what we were talking about pre-diabetes. If you have normal fasting blood glucose or normal blood sugar levels, it is okay. But if you have risk factors like obesity, your family history of diabetes, and as you are telling that you have been diagnosed as pre-diabetes, then lifestyle modifications are very, very important. If your weight is more, you must reduce your weight, you must exercise, you must get the blood sugar done very regularly, so that you have come to know that the blood sugar is controlled. So blood sugar control means fasting blood sugar less than 120, the random blood sugar should be less than 170. So if it is not, you should have dietary modifications. Dietary modifications is according to calories. So we must avoid the simple sugars. We must take complex sugar. We should increase high fiber diet. The fiber in the diet should increase. Lesser calories. So lesser calories means according to the weight, we must calculate the calories, and accordingly we must take calories. So in diet, we should reduce fat, we should reduce simple sugars, we should increase complex sugars, we should have balanced diet, that is about 50% of carbohydrates, 20-25% of proteins, and 20-25% of fat. So the fat should be the polysaturated or the other saturated, non-saturated fats. So that should include in diet, and you must control your blood sugar. Otherwise, if you don't act now, you will be full-fledged diabetic patient in a few years.
Once again, sir, thank you so much. And sir, the next question which we received from Subhamay Sarkar from Silchar, and his question is, in my maternal side, almost all are diabetic. How likely is it that I will also be diabetic?
So that depends upon your genetic profile. You may or may not be diabetic, but if all maternal relatives are diabetic, you should be careful about diabetes. So you should get regular blood sugar check done, and you must go for lifestyle modification now only. So most important is your ideal weight, your exercise, your dietary profile. So that will prevent diabetes in your case. So you should be very careful, because the family history of diabetes is very important risk factors for incidence of future diabetes.
Thank you, sir. Sir, we have received the next question and the last question, of course, of this session. So the question is, if I forget to take my diabetes medicine once in a while, then will it have any adverse side effect? And the question is from Uttam Singh from Ranchi.
Definitely. It has got more side effects rather, because it will cause variability in sugar levels. So once your sugar level is normal, if you don't take medicine, the sugar level is going to increase, and then again the sugar levels are going to decrease when you take medicine. So you should be very careful in intake of medicine, so that the sugar levels don't go up or down very frequently. That is why nowadays continuous blood sugar monitoring for a few days is very important, to see the blood sugar variability, which has come up as an important risk factors in diabetes. So we must try to control blood sugar levels and take medicine regularly, without missing the dose and causing the blood sugar variability.
Thank you so much, sir. Thank you so much for answering all the questions from our viewers. And thank you so much, sir, for your valuable time, and sir, sharing your valuable insights too. And thank you so much all the participants for their valuable presence at our session. And sir, we hope we would have again your presence in our next session, in our future sessions too, sir.
So definitely, I am looking forward, because we are initiating a monthly program for common people to generate awareness on the platform of RSSDI Punjab chapter, as well as Diabetes India, under the leadership of Dr. Shashank Joshi, Dr. Bansi Sabu, Dr. B.M. Makkar, and Dr. Amit Gupta, and few important persons. So we are trying to generate awareness among common people, and thank you, DocTube, for giving me the platform to project, and thank you, ClearNet. So next time, I think I did not know that we should go in for slide show also. So slide program, next time I am going to make for awareness of the people, so that will not miss anything. So I'm sorry if I'm missing anything, but still my phone number is with you. You can call me from 11 to 2 p.m. for any queries, for treatment, for lifestyle modifications, for prevention of diabetes. Thank you very much.
Thank you so much, sir. Thank you so much, sir. With all your permission, we can just conclude this session here, sir.
Okay, thank you.
Thank you.